Hello everyone, it's me Amogh, studying third semester Pharm from RR College of Pharmacy, Bangalore. Welcome to Pharma Achievers. In our YouTube channel, from now onwards, we are going to discuss the topic based upon the semester wise. Initially, we will begin with all the subjects of the first semester Bpharm, continued with the all semester. The topic today which I am going to discuss is about the biphasic liquid dosage form. First, we should understand the title and the concept. Biphasic liquid dosage form. Biphasic means there are two phases. Two phases initially in which it can be one will be the continuous phase and another one will be the internal phase or dispersed phase. See, mainly in case of the biphasic liquid dosage form, it is broadly classified into the two categories. One is the suspension and another one is the emulsion. The first we will see the major difference between the suspension and emulsion. See, in case of suspension, the drug will be present in form of the solid particles, which will be dispersed in case of the solvent. But in case of emulsion, it consists of biphasic, two-phasic, it is also biphasic liquid dosage form, in which the solid particles will not be there. The drug will be present in another form, the another liquid form, such as one will be the aqueous phase and another one will be organic phase, like that. The drug in the liquid form only, it will be dispersed in the solvent. That is about the emulsion. Let's see about suspension. A suspension is a biphasic liquid dosage form of medicament in which finely divided solid particles dispersed in liquid medium. See, there comes the several definitions like solution, dispersion, like that. If the drug or the solid substance it is completely soluble in case of the solvent, in the solvent, then it is called as a solution. If it is not completely soluble, if it is dispersed, it is called as dispersion. If it is emulsified, it is called as emulsion. Similarly, here the solid particles will be dispersed in the liquid medium. The particle size of solid will be ranging from 0.5 micrometer to 5 micrometer. This question can come in the GPAT, in which it will be asked like the particle size of solids in the suspension will range from 0.5 micrometer to 5 micrometer, 5 to 50 micrometer, like the four options will be given. We have to keep in mind 0.5 micrometer to 5 micrometer is the particle size of suspension. As I said, in this case, the solid particle will be dispersed phase or the internal phase. Liquid vehicle, it will be continuous phase or external phase. Suspension, it can be used for the oral use, parenteral use, external use and ophthalmic use. It is also suitable for dermatological materials, means topical preparations. How can we say the prepared suspension or available suspension it is good? The qualities it should have. It should settle slowly and readily dispersed upon the gentle shaking. Settle slowly means, I said solid particles will be there, it will be dispersed in the solvent or the liquid phase. When it is dispersed, it should move slowly or it should settle slowly. And when it is shaken in the bottle, it should get redispersed easily. It should spread in the entire content of the solvent. It should not be at the top floating, it should not settle down at the bottom, but it should be dispersed throughout. It should be readily pourable. See, what if you have prepared the suspension and it is unable to come outside of the bottle? It is having too much viscosity. Then it is not the quality of good suspension. Good pourability should be there. It should be chemically inert. The ingredients are drug, excipients, solvent, preservative, buffers, sweeteners, all the ingredients that are used in case of the suspension, it should be inert. It should not react with each other. Dispersed particles should be of the uniform size. Yeah, just keep this point in mind. About the uniformity of the size of the particles, let's discuss in case of the stability problems. What happens if the particles are ununiform? If the particles, one will be having 5 micrometer, one will be having 20 micrometer, if the size is different, whatever the problems occurs, let's discuss in the further. Suspended particle should not form the cake. The drug particle dispersed, it should not settle down and it should not form the cake. It should be chemically and physically stable and acceptable. The suspension, it should be physically stable, means the phase separation should not occur, dispersed particle should not settle down, should not float, or should not adhere to the sides of the container like that. Chemically stable means it should not melt or it should not get interact with each other, form the sedimentation like that. After understanding the concept of suspension, let's see the advantage and disadvantage of the suspension. This topic is from the first semester Bpharm. This suspension topic may come for the 10 marks or 5 marks or 2 marks. When they ask for 10 marks, the question will look like define and classify suspension and write the advantage and disadvantages of the suspension with the methods of preparation like this, or they ask the stability problems of suspension or method of dispensing of suspension. For 5 marks it can be asked. These are the questions in which they arise from the suspension topic. Let's see the advantages. Suspension, it improves the chemical stability of the drugs. Procaine penicillin G, for example, I have taken. See, procaine penicillin G, it is an antibiotic which is used for the wide range of the bacterial infection treatment. I have to give a fact about here about the procaine penicillin G or penicillin. See, penicillin, it will occur in the two form, benzathine penicillin and procaine penicillin mainly. Benzathine penicillin, in which it is a least soluble form of penicillin, in which it will act for the longest duration of action up to 3 weeks. But the procaine penicillin G, it should be injected daily once. It is having good solubility, good bioavailability, good elimination, so it should be injected once in a day. But benzathine penicillin, it is administered once in a 3 week. This was fact about the penicillin. See, the procaine penicillin G. The penicillin, it is given in the injection form. It is not given in the oral form, oral route. Because when the oral route it is given, there might be chances of the degradation when it comes in contact with the gastric acid that is present in the stomach. So it is not given in the form of tablet, capsules, chewable tablet like that. It is given in the form of injection, penicillin. Drug in the suspension have the high rate of bioavailability. I said, in case of the oral route, we know the oral route disadvantages. It is having the gastric acid in the stomach, in which it will degrade our drug. In the liver, hepatic first pass metabolism, that is biotransformation reactions. Phase 1 reactions, phase 2 reactions. For phase 1 reaction example, oxidation reduction may occur, hydrolysis may occur. For phase 2 example, phase 2 biotransformation example, glucuronide conjugation reaction like that. See, all these reactions, it will cause us the reduced bioavailability. Hence, some of the drugs are given through the parenteral route only. Yes, when we give through the parenteral route, it will reach the blood directly, hence bioavailability will be more. Duration and onset of the action can be controlled. Example, protamine zinc insulin suspension. See, whatever we are talking about oral route or parenteral route, it is of the past few years. Very old topic. Recently, what controlled release system are coming, sustained release systems are coming, prolonged duration, prolongation of the action of the drugs, they are coming. Nanoparticles are coming, nanosponges, proneosomes, liposomes. See, all these are the new topics that are emerging in the pharma field. Biofilms. These are all the newest form of the treatment, newest form of the dosage forms. When we speak about medicine, we will only speak about the tablet or capsule or syrup. In larger case or in rare case, we will speak about the parenteral drugs. But nowadays, the Bpharm students, they are involved in the research. They are doing a novel drug delivery system. They are formulating the different formulations such as liposome, neosome, ethosome, proneosome, biofilms, nanosponges, nanoparticles, like that. All the new concepts. See, by the advancement of the medication, that is novel drug delivery system, what happens? The medication that can be given can be controlled or sustained or prolonged, like that. It is having the different advantages. Let's coming back to topic. Suspension can mask the unpleasant taste of the drug. See, in suspension, it is similar to that of the simple syrup. See, syrup. See, in the case of the syrup or the suspension, it is consumed through the oral route. We are going to add the sweetening agent or flavoring agent. It will cause it will cause masking up of the unpleasant taste of the drug. These were the advantages of the suspension. Now coming back to the disadvantages. Physical stability, sedimentation and compaction problems can cause the problems. See, physical stability, sedimentation and compaction. These are the problems in case of suspension. Sedimentation, as I said, the dispersed particles after some time when you keep in the shelf or when you keep in the rack, in case of the medical store suspensions, the drug particles, when there is a no motion or when there is no shaking, the drug particles try to settle down. Tyndall effect will not be there. The drug particles will not collide with each other. They will not remain in the entire solvent. They try to sediment due to the gravitational force. Physical stability problems might be there. These are the problems. It is bulky. Care must be taken during handling and transport. See, in simple terms, we will compare about the tablet and the suspension. Tablet, it is a unit dosage form in which, for example, Dolo 650, you can take in a hand and you can easily consume. It has very shorter space and it is not bulky. It is a unit dosage form. It is easy to administer. But in case of suspension, it is bulky. It is in a bottle and there may occur what improper dosing. They might have mentioned 25 mg per 5 ml, but it's very difficult to get the accurate dose in case of the suspension, because the layman or the normal people who are administering a drug themselves, they may pour 5 ml, they may pour 8 ml or 7 ml instead of the 5 ml, or they may take 3 to 4 ml. Then the drug dose decreases in that case, and it is difficult to formulate. See, difficult to formulate. Simple example, tablet. In tablet, all the ingredients are mixed. They are gone for punching. After punching, you will get the tablet easily. But here you have to select sweetening agent, you have to select flavoring agent, you have to select the solvent, you have to select the particle size of the suspension. All these concepts should be kept in mind. Uniform and accurate dose may not be achieved. As I said, accurate dose problem. Because 5 ml, if the dose mentioned is 5 ml, it is difficult to take exact 5 ml, 8 ml or 3 ml. Improper dosing may occur. These are the disadvantages of the suspension. Thank you. Like, share and subscribe for my YouTube channel for more videos. In the next video, we will see about the classification of the suspensions and the method of preparation of suspension and evaluation of suspension, stability problems regarding suspension and method of dispensing of suspension. These are the topics in which will be covered in the next video, upcoming video. Thank you.